Gloucester Hospitals has recently acquired the Versius robot, which is the next generation surgical robot, and we've started doing live cases today. It's been a long time coming, getting to this point. We've been in discussion with the company for some time to get the robot in place in Gloucester Hospitals for the benefit of our patients. As a background, robotic surgery as a discipline has been around for 20 plus years with a single platform provider, which we have in the hospital as well. So in Gloucester Hospitals, we've got a robot which has been in use since about 2013, mainly for prostate surgery and some gynae surgery as well. So I suppose the first thing to say is that it's not the robot doing the operating. There's a very experienced surgeon sat at this console doing the operating, and the surgeon controls the robotic arms which hold the instruments. And so instead of being a sort of two-dimensional world where you're operating, you've got a 3D picture, and you've got robotic arms which allow the instruments to work in a way much more similar to the human wrist and arm than with standard laparoscopic surgery, which is more like operating with long sticks. So in terms of the view, you get a 3D view. The robot arms get rid of any potential tremor that there might be in human hands. And also it transfers your movements on the controllers of the robot into very precise movements, and it allows a huge range of movement at the end of the instrument. We're generally operating around important structures, so big blood vessels, structures that you don't want to damage, and in addition, with various operations, we're operating in confined spaces where your access is limited. So for instance, operating in the chest or operating in the pelvis and certain other areas in the body, it allows you to operate in a much more enclosed space without problem. Both patients will go home today as day cases. So they came in first thing this morning and they'll go home this afternoon.